Good evening. You're watching Straight Talk with Eugene Chan. Our guest tonight is Professor卢宠茂. He is our new Secretary for Health. He is a specialist surgeon, internationally renowned for his expertise in hepatobiliary surgery and liver transplantation. Prior to his appointment to the Hong Kong SAR government, Professor Low was Hospital Chief Executive at the University of Hong Kong Shenzhen Hospital, Professor and Chair of Hepatobiliary and Pancreatic Surgery, as well as the Director of Liver Transplantation Center at the Queen Mary Hospital. So tonight, we're very happy to have Professor Low with us to talk about the latest quarantine measures. And Professor Low, the press conference you had last week, I must say, one of the most awaited, happy press conferences we had for a long time, because many people were waiting for a new measure coming out. Of course, before the conference, there were a lot of rumors. There were 5+2, 4+3, and eventually 3+4. So there is also a bit of a delay in the announcement, but I'm sure there was good reasons for it. So how did you arrive at this final formula of 3+4? I'm sure the viewers would love to know.
Yeah, we want to make sure that whatever policy we adopt for anti-epidemic against COVID, it has to be evidence-based and supported by data. So when I first analyzed the situation of these inbound travelers, we noticed that we have only a PCR test on arrival and also on day 5. And the number seems to indicate that we may not need 7 days of quarantine before we can stop the majority of the positive cases from entering into the community. We obviously understand that there's a price to pay for all these quarantine measures, for both for the inbound travelers, but also for the Hong Kong economy. So starting from July 8th, we put in an extra PCR test on day 3 after arrival. And those are very important data that we need. And after implementing this PCR test on day 3, we have enough data for after 4 weeks. So we analyzed it and found that 80% of these positive cases can be detected and stopped from getting into the community with the PCR test, with the 2 PCR tests after arrival. And the percentage of inbound travelers who tested positive recently is around 4%. So if we can detect 80% of these within 3 days, we will reduce the overall positive rate of the remaining passengers, travelers, down to under 1%. And this is a positive rate which is comparable or even lower than the recent local community positivity rate. And we found that this is an acceptable level. And together with the fact that we implement the amber color code, health code, which will effectively try to restrict these inbound travelers from getting into the high-risk community area like restaurants and bars. And also with more PCR tests, we are very confident that there will not be any extra risk for the community.
So Professor Low, so what you're saying is you're based on data to make this decision.
Exactly.
So were this data, so I assume this data weren't available to the last government. So maybe that's the reason why they didn't move on to your new initiative. So with this new way of quarantine, and many businesses, especially the tourist and retail industry, they welcome that as a welcome relief. However, they still felt that it's a bit conservative. So would you say that perhaps this is sort of what we call a first installment in a stepwise arrangement? Well,
we've got a glass of water here. You can always say that it's half empty or half full. I mean, this is the same concept, right? But we must emphasize that COVID is not over yet. Now, some people say that it's over, and some people argue that it's just a flu. I would submit to say that until recently, COVID is not a flu. It's got a much higher severity, and it's got a very high mortality rate, death rate, for our elderly, as well as in certain kids. We know there are already 8 deaths in children under the age of 11 in our 5th wave. And we have 9,000 deaths in the 5th wave as well. The other unique thing about this COVID, even the Omicron, is that it's got a very high mutation rate. The seasonal flu comes once a year, but this COVID comes every 2 to 3 months. There's a surge in the global, even in the summertime, the COVID, there was a huge surge globally. And you would never imagine seeing this flu in summertime, right? Even with the heat wave, the heat wave cannot take care of the COVID. So right now we have to be, still have to be cautious.
Right. When you're saying that, that means it's much more serious than the flu as compared to what the rest of the world thinks. So are we still working towards a quarantine-free travel for Hong Kong?
We are considering anything which can reduce the cost for our living and the economy. But at the same time, we have to make sure that we can protect the health of our local community. The healthcare system is the major issue of concern. Even at this time, you will understand from the recent figures that we have over 4,000 cases a day. Some people argue that it's not important, but we have over 1,500 patients with COVID in hospital, and 10% of these require oxygen treatment. Now, this is not a small number. It's roughly about 7% of our total hospital beds, and the trend is rising, especially with the recent admission numbers. The worry is that it will affect our hospital service. And the hospital authority is actually considering that if the trend continues, there is a chance that around 25%, 1/4 of the regular hospital service will be affected.
Right. Professor, I think you have stated yourself very clear that you are concerned, you're worried. You say this is not just a normal flu. I think a very loud and clear messages for our viewers. Someone who knows you very well wanted me to ask you on the show that why are we still different from the rest of the world? I'm basing, of course, what you said is true. Why are we still different from the rest of the world? And he thinks that we should be 0+0. That may be a bit drastic compared to what we're doing now, but you can see the sentiment in the community. A lot of people feel that way. So how do you answer your friend on that?
I'm glad we are different from the rest of the world because Hong Kong is not UK. Now, I'll take UK as an example. UK has several lockdowns of the whole country during this COVID. And the total death due to COVID has exceeded 200,000. If you consider the population of UK compared to Hong Kong, less than 10 times Hong Kong. So Hong Kong will, if we are UK, we will have more than 20,000 deaths by now. Compared to that, we have only 9,000. In a way, we are also a victim of our own success because we have been so successful before this 5th wave. The vaccination rate is comparatively low, especially in the elderly who feels that we're so safe in Hong Kong, we don't need the vaccine. Now, but the 5th wave actually came as a shock for us. So we are different from UK and the rest of the world, from Singapore. We have a much more aging population. We have 400,000 elderly, over 80, and 120,000 of them have not received a single shot of vaccine. This is a victim of our own success, as I said. And our healthcare system is different. And our habit, the people's culture and habit of visiting hospitals and taking care of our elderly is also different. In Western countries, I must say, during the COVID pandemic, in the peak of their surge, a lot of elderly were actually left in elderly homes and at homes, and they were asked not to go to hospital. And the attitude of treating this elderly are quite different. Whereas in the Chinese community, I can tell you, especially with my experience in Shenzhen, even a 90-year-old elderly in the family, if they are previously healthy, many of them are healthy, they can take care of themselves. Right. They are ADL independent.
I can certainly identify with the feeling because my father passed away through the fifth wave. So, but having said that, a lot of people still want Hong Kong to still keep going, despite a health concern. I mean, all the guests have been on our show have shown a lot of concern about our economy in different sectors. And another comment that I will bring to you, because they know that you'll be coming to the show, is that hotel quarantine is still a stumbling block for many of the economic activities. One group suggesting Could you have the travelers start a daily PCR, say 3 days prior to travel, so they were able to submit a 4-day negative PCR test report on their arrival? And as you know, the incubation period of the Omicron variant is 2 to 4 days, so in effect, they are deemed negative on their arrival. Then we can have them being at home and still for quarantine for 2 days and do rapid tests. What do you say to that?
Well, yeah, you bring up a possibility, a good option, which is like reverse quarantine. They have this test before arrival. But let me tell you the figure right now we have. Something which is beyond our control. Different countries have different way of looking at this COVID. I must say it must be individualized. Different country, different city, we're different. Now, for example, looking at the arrival figures, the average is about 4% positive rate. But if you look at the Western countries, especially Europe, France, Germany, the positive rate is as high as 8 to 9%, much higher. And whereas the Asian countries, you look at Philippines, Indonesia, you'll be surprised. The positive rate is only about 1 to 2%, much lower than the Western countries. Reason? Well, maybe the PCR test, the accuracy, maybe it's because during the 48 hours between the PCR test and the departure, their living conditions, right. Whether they go out to a bar to have a drink, right, whether they wear the mask. And I was... The many factors, yes. I was told that in the Philippines, especially the domestic helpers, because they're coming to work, they're very conscientious. They don't go out. Okay. 2 weeks before they come to Hong Kong. That's how we come to this figure. I hope every country, every place will adopt this approach.
Right, Professor, let's have a break and we will be right back. Welcome back. With us tonight is Professor Low, who has been talking to us about the new quarantine measures. Before the break, we talked about the rationale behind the new quarantine measures and answered some of the viewers' questions. So, Professor, you have been in this position for 6 weeks, and in the first week, you did reject calls for quarantine-free travel as you were concerned about our healthcare system, whether they could be overloaded. At that time, we had like 3,000 cases. But recently, even up until today, we are close to 5,000 cases. Actually, we have more cases than before. So what information are you basing on that enable you to embark on this new quarantine measure to get things moving?
Now, if you look at the original prediction in early July, at that time the number was actually rising. The fifth wave is a surge of is a rebound of the fifth wave. It roses from about 200 to 300 to 2,000 to 3,000 in early July, and at that time the R0 was actually 1.8. So, giving a number that our number may double within 2 weeks, in less than 2 weeks. That was quite alarming. We know that already. But those are not due to inbound travelers. We analyze the numbers. The percentage of positive cases due to inbound travelers is actually around 5 to 6%, under 10%, way under 10%. So that was why we said, this is something we can look into. Trying to reduce the costs for Hong Kong in terms of its economy. And also, President Xi has repeatedly emphasized that Hong Kong has to keep its unique position and advantage as an international city hub and also as the window for our motherland. So we need to make sure that our anti-epidemic policies are compatible with that. So that's why we look into this and come up with this 3+4. I have to emphasize, 3+4 is still equal to 7. So we haven't relaxed, we haven't cut down anything, but we are more precise. This is like precision medicine. Now in medicine, I'm a doctor, we want to treat a disease. We obviously want to hit the bad thing, the cancer cell, for example. So it's like the target therapy we have now. We want to make sure that the cause is spared by all those who are infected rather than non-infected. And that's why we try to avoid increasing the social distancing measure, which is very non-specific. But at the same time, we increase our PCR tests. We have doubled our PCR tests from 60,000 a day to now about 120,000 a day. And the test result turnaround time is under 24 hours, much faster. By doing that, we identify the infected earlier so as to stop them from spreading. So with that, we are reducing the number of infection caused by each infected. Our R0 has reduced from 1.8 to latest 1.06 now, so under 1.1. And we are hopeful, we are going to that direction. We want to make sure that the R0 go under 1. Then the number will decrease.
Yeah, thank you very much for sharing your thought processes. That means it gives a very clear indication to the viewers that we're actually actively combating it rather than retrieving from it. Well, most people thinking the rest of the world, I've got friends traveling overseas, I'm sure you have too, saying, oh, look at Hong Kong, the rest of the world is bustling. Why are we still doing this? Why are we taking this so seriously? So from your point of view, we're actually fighting it. What if, unfortunately, the case numbers keep on going up? Will you reinstate the previous quarantine measures?
Something that we don't want to. Some of these which are non-specific, we would try to avoid. But I must emphasize that we are still, facing a very sleek, very cunning, very unique virus. This virus, even WHO and some world experts have warned us that this epidemic is not over. In case there's a mutant which is more virulent than the current Omicron, we may be facing another big wave and serious disease. Mm. So we have to be cautious. One of the things that I think Hong Kong should do is that while we are trying to ease the less specific measures and try to restore our normal life and international connection, we have to be prepared for any epidemic. Right. We know these emerging disease, SARS is different. It's over after 6 months. But now there's COVID. We never imagined that. People who try to have, like a fortune teller trying to predict the evolution of this virus, they all fail. The crystal ball never worked. Right. So I don't want a crystal ball.
CM, let's move on to something else. The new measure has been out since last Friday. We have the Amber Code, we have the 3+4. And at the moment, we know that travelers can't attend conferences or trade shows. And I think something that we have to accept, as you said, a half glass of water, which side you look at. But this really severe reduces our competitiveness in business and tourism as compared to Singapore. And organizers will want to plan ahead what's going to happen. And we had Bernard Chen here. In March, he said that we should have a roadmap. So would it be too premature for me to ask you this question? Do we have a roadmap? Because we have to plan ahead. Say, if we're going to follow this stringently, maybe in 2 or 3 months' time, we'll be looking at further relaxation. Can I ask you that question?
As I said just now, I don't want to be a fortune teller. And
if everything goes as planned?
I don't have a crystal ball. And even if I do have one, I don't want to use it because COVID is unique. The crystal ball doesn't work for COVID. On the other hand, I must say we do have a plan. Our plan is to increase all those more specific and more targeted measures and try to reduce the less specific, like the social distancing measure. For the inbound travelers, for example, that is how we can come up so quickly from 7 days to this 3.4. I hope everybody sees this as an improvement. We will continue to work towards that direction, but we do need to consider, one, the epidemic situation, the numbers, and also how this virus evolved. But I can assure you we are working towards better international connection.
Professor, on Straight Talk, we do have a lot of viewers' comments. I'll have to bring them to you, which I think is quite fair. They were saying that one of the very senior director grade of the disciplinary forces went out for a holiday and come back, and she said to me she is concerned that our international reputation will be tarnished because the process is being so long. But before I could ask you that, over the weekend, I read the news that the new streamlined process at the airport, 95% of people will be cleared within 50 minutes. They can be at the hotel within 1 to 2 hours. So we must congratulate you on your work. So how did you do it? Why can't we have this earlier? Because everybody is suffering at the airport.
I don't want to talk about history. I'm not a historian, right? But I do learn from history. The thing is, the first day that I start officially working, it was July 4th, because the first 3 days were all public holiday and typhoon, but I was actually working. I went to the airport to look at the whole process. You know, there's a lot of areas for improvement, and I heard from various people talking about the whole process, about the health declaration, the registration for the PCR test, and also for the release of the quarantine order, a long waiting time there. Sometimes it takes 6 to 8 hours to be there, and then the bus service was quite crowded and so on. So we go through the whole process. The team were all there, airport authority, port health staff, our Department of Health. The thing is, we now use technology. The registration, we have a new health declaration code, which all passengers can register pre-departure. So they can do it there. Once they register, we don't need them to re-register again. We give them a QR code.
Professor, sorry I have to stop you off short there, because I want to ask you the last question, because there's a lot of information. Hope the viewers will get it. With the new procedure, hopefully things will go back to normal as much as we can. Fanny Young of the travel industry said that all these procedures are more likely to increase more people going outbound from Hong Kong going overseas, like 20-30%. But you were saying you were expecting a jump in as much as 80%. Can you have a very quick answer for us? What makes you say that? Although you don't have a crystal ball, but there must be some ideas you're basing that on.
It's always a two-way traffic. I don't think we are only seeing people leaving. Now, even the local people traveling, I think this is of good added value. Many of my friends are complaining that they haven't been out there for long. So it's a two-way traffic. I don't see why.
But you're saying there were 80% of people coming in.
I'm saying 60 to 80% of the arrival and departure. Of course.
All right, I see.
Whoever leave will be coming back. They will become an inbound traveler as well. Right? Hopefully, we're not only seeing a one-way traffic from Hong Kong.
Hopefully things will move better from now. So thank you, Professor Loh. I'm sure many of us hoping that this new measure will be the beginning of the road back to normal for Hong Kong. And have a good week, stay healthy, and good night.